Okay, well, thanks for your patience. Sorry, we're back live again. A little technical difficulty. So welcome to our Friday educational webinar on the basics of Medicare in detail. So every other week we focus on a more comprehensive look at Medicare from A to Z. Everything you need to know explained in the simplest terms possible. So let's go ahead and get started. My name is John. I'm president of Riley & Associates, and we are a local independent health insurance agency specializing exclusively in Medicare with over 2 decades of health insurance experience. I'm going to take you through much of what we go through with our clients during a personalized presentation following their discovery call. That way you get a good idea of how you work with us. With our clients, we go into a specific recommendation and costs based on their needs assessment. However, for this meeting, this presentation will just be, generic. We'll provide you with a good idea of what you should expect. So our goal here today is to keep it simple. That said, Medicare has a lot of details, rules, and deadlines. So we'll be covering quite a bit today in hopes to answer as many of your questions as possible. Okay. So what is Medicare? Medicare is health insurance provided by the federal government for those age 65 and older, and those under 65 with certain disabilities. Now, most people are eligible for Part A and Part B if they are 65 and either they or a spouse has paid into the Social Security system for 10 years or 40 quarters. Now, Medicare has 4 parts, and we'll begin with Medicare Part A and Part B, which is also known as Original Medicare. So you either enroll 2 to 3 months prior to age 65 or later when you retire or come off your large group employer plan. So Medicare Part A here is your hospital insurance. This covers inpatient stays and skilled nursing. Part B is your medical insurance. This covers things like doctor visits, labs, x-rays, and diagnostics. Now, Part A is usually free for most people as long as you or a spouse has paid into the system for 10 years or 40 quarters. Part B, however, does come with a premium. It starts at $202.90 for 2026 and is adjusted up for those that are higher income earners. And we'll address that in a chart here in a couple of slides. Okay. So now that you know what Original Medicare is, Part A and Part B, let's put all of these together. So Medicare has 4 parts. Medicare Part A is your core health insurance. This covers your inpatient and your medical services. And Part C, also known as a Medicare Advantage plan, is an alternative way to receive your benefits. And Part D is your prescription drug coverage. So before we go any further, let me suggest just a couple of things, especially for those of you that may not be planners, to set up a discovery call 3 months prior to the month you turn 65, or when you plan to move off your large group employer plan and sign up for Part B. Well, why is this important? You don't want to miss a step or a deadline. During this call, we determine your timeline here. Let me see if I can get my pointer right. Determine your timeline, your coverage, compare coverage for you. We'll create a schedule based on your needs. So basically, we set up your path, we guide you through the process, and get you enrolled on time in a plan that's right for you. So also for employers or partners that might be viewing this today, we would suggest a planning meeting at age 62, as income and other events could affect their Part B premiums. So we have a planning checklist and video link that better explains that. You just click the form linked below and we can send that out to you. So now let's go ahead and we'll move on to the initial enrollment period and other specific election windows. Okay, this is really important stuff here. There are 3 main enrollment periods that you need to understand at this point, and then a couple which I'll just tell you about. Okay, The initial enrollment period here is when you're going to sign up for original Medicare. Okay, and that's for original Medicare Part A and Part B. And then you'll also choose coverage at that time or within a month of that. That will start at the same time. So when you sign up for original Medicare Part A and Part B, you have a 7-month window. You have the 3 months prior to your birthday month, the month of your birthday, and 3 months after. Okay. So note, if your birthday falls on any day of the month, then say for example your birthday is in April. If it's you're going to determine, you're going to go ahead and sign up usually 2 to 3 months prior to that birthday month. Your Part A and B will start on the effective day, first day of the month, and so say it would be April 1st. However, if you were born on the 1st, it's actually going to start a month earlier, just so you know. So if you signed up for Part A and Part B here in January and your birthday is April 1st, your coverage for Part B is actually going to start on March 1st. So just something you want to note, and we would definitely make you aware of that. Okay, so let's look at Part A and B, also known as original Medicare. There's some out-of-pocket costs here that you'll need to cover, and you've got 2 different options, which we'll talk about those here shortly. Okay, so here are your out-of-pocket costs. For Part A, you've got a $1,736 deductible for Part A. That's for hospital. So, and that's not annual. That's adjusts a little bit each year, but that's not an annual deductible. It's on a per incident basis. So if you are hospitalized and you'd pay that deductible, and then if you were out of the hospital and then went back in after 60 days, they could effectively charge you that again. All right, so that's something to know. But we're gonna take a look at 2 different ways to cover these costs. So you're gonna have an out-of-pocket cost for Part A. You would also have co-insurance if in skilled nursing past 61 days. You have a Part B premium that you can cover through an HMO Advantage plan, and then also your 20% co-insurance, which we'll show you how to cover. Okay. So at the beginning of this presentation, I said for most people, there was no premium for Medicare Part A, which is true. Part B started with a premium of about $200 and $290 for most people, and it was adjusted up based on your income. Okay, so this chart is known as IRMA. It's called your Income Related Monthly Adjustment Amount. And so if you're making a higher income, you're in a higher bracket, whether an individual or a joint filing, you're going to pay more for your Part B premium. And what they're going to do is once you sign up for original Medicare Part A and Part B, they're going to send you a bill for the first quarter, for the first 3 months. So, if it's $200 and $290, you're going to get a bill for about $609 for that first month. You can then sign up for what's called Easy Pay, so they deduct it from your paycheck or from your checking account monthly. If you're on Social Security, they will automatically deduct it. But just something to know that you're going to get that bill for the first quarter. And then something else too is that when they determine what your Part B premium is going to be, they look 2 years back on your tax return to determine that. So if your most recent return is lower and it drops you into a lower bracket, then you can file what's called an appeal, and Social Security will review it and then possibly lower your Part B premium. We can help you with that. We've got an email and the form and all of that. So, okay. So now let's go ahead and jump in. We'll take a look at your coverage options, a way to cover those costs. And before we jump into that, I want to go ahead and cover what's called your current coverage. So either you're on a PPO plan now or you're on an HMO plan. Okay, and I want you to understand how they're similar to what you have now when you're looking at original Medicare. So you're either on a PPO or an HMO, either with an individual plan or an employer plan. Okay. And so plans usually have a PPO plan usually has a higher premium, you have some higher out-of-pocket costs, but it gives you a lot more freedom. An HMO plan usually is a lower premium with lower out-of-pocket costs, but you have a network that you must stay within, and a lot of times there's authorizations and referrals that you need to get. Okay, and so when we start looking at original Medicare, and then what your options are to cover those out-of-pocket costs, they're going to be similar. It's going to be similar to a PPO or similar to an HMO. So it's really not that difficult. So let's take a look at it here. So everyone must get original Medicare Part A and Part B to cover the out-of-pocket costs. You're also going to get either a supplemental on Part D, or you're going to go to a Medicare Advantage plan, which covers Part A, Part B, and your prescription drug plan. Okay, so option one works like a PPO model. It gives you freedom, and you're just going to add a supplemental on Part D to cover your out-of-pocket costs. If you go with the original Medicare and a supplemental, you can go to any doctor, any hospital throughout the nation that accepts Medicare. So you don't have any network. You've got real freedom there, no referrals or prior authorizations. The only cost you're going to have if you go with this option one is you're going to have the Part B deductible, which is $283 for 2026. So once you pay through that at the beginning of the year, then everything else is covered. Okay. For your second option, which is your Advantage plan, Part C, it operates more like an HMO. So it's with a carrier. They cover Part A and Part B and include Part D prescription drug plan. Okay, so both are really excellent options and give you very good coverage. It just really depends on kind of what your budget is, what you're used to, and what your needs are. Okay. So let's first take a look at your original Medicare option with a supplemental in Part D, okay? Just so you understand that. So when you have original Medicare with a supplemental plan, the way it's going to work is you go to your provider, you give them your Medicare card plus your supplemental card. The provider will go ahead and bill Medicare for those services, and then Medicare will pay their part, and then they will bill the Medigap or supplemental plan, which is the same thing. They'll bill the supplemental carrier for the balance. And like I said, your only cost is going to be at the beginning of the year when you pay through that $283. Other than that, your supplemental is going to pick up everything. Okay. So here are some of those costs that are being covered. Your Part B co-insurance and co-payment, the 3 pints of blood that Medicare does not cover, your Part A co-insurance and hospital out-of-pocket costs, skilled nursing, Part B excess charges, Part A deductible, hospice, out-of-pocket maximum, and travel as well. They give you some for travel, which is $50,000. Okay. And so now let's take a look at your second option, which is your Medicare Advantage plan. Okay, your Medicare Advantage plan is going to work just like an HMO. So when you choose a Medicare Advantage plan, it's going to be covered by a private insurance company. They're going to cover Part A and Part B, and they're going to also include a prescription drug plan. Okay, so this is going to work just like an HMO plan. You're going to have a primary care physician that is going to direct your care. You're going to be part of a medical group and within a local community hospital setting. And you get a lot of bang for your buck here. We've got one of the best HMO networks in the country. So you've got a lot of choices here in Southern California, and they give you a lot of extras as well. So here are some of the extras. So it's going to cover Part A and Part B plus your drugs. And then it's also going to include dental, vision, hearing, and gym membership. Okay. So these are your two options. It's either original Medicare, Part A and Part B, adding a supplemental in Part D, or it's option 2, which is a Medicare Advantage plan that works like an HMO. And it includes Part A, Part B, and Part D, your drug plan, and gives you extra benefits as well. So you're going to pick one of these two options just based on, kind of what your preference is, your lifestyle, your budget. Okay. Moving on to Part D. Part D is your prescription drug plan. So when you sign up for original Medicare Part A and Part B, you will also sign up for Part D at the same time. So either you're going to purchase it separate with your supplemental plan, or it's going to be included in your HMO Advantage Plan Part C. So just a few things here to point out. It works just like an HMO. So it works. It's built into either your HMO or it's separate on a PPO plan. Okay, on the supplemental plan. So let me restate that. It works just like the drug plans built in your PPO or your HMO plan. And so just like it's been in the past, the only difference is you've got, if you go with original Medicare with a supplemental, then it's going to be separate. If you get the Advantage HMO, it's going to be included, but it's going to work just the same. You're going to have just copays for generic brand and non-formulary brand. So you're going to have these different tiers here. Most of them have a separate deductible built in for brand and non-formulary, and it's also has a separate out-of-pocket maximum. So whether it's included in your Advantage plan or you have the separate Part B with your supplemental, you still have an out-of-pocket maximum of $2,100. So it's going to work just like what you used to in the past. And this is just a little different way to look at it. So if you've got formulary drugs and some brand name drugs, you're going to pay through that deductible. Then you're going to pay either a copay or co-insurance, and you're stopped out at $2,100. Worst case scenario for 2026. Okay, so if you're not taking any medications, then you're not going to have any costs here. If you have generics, you may have no cost, or you may have some small copays that you're going to pay, but you wouldn't pay through that deductible in most cases. So that's the way it works there. And then, as we discussed earlier, if you trigger that income-related monthly adjustment amount, that chart for Part B that we showed you for higher earned income premium. So if you're saying, say for example, in that earlier chart, you're in the second area where you're paying $284 rather than the $202, then you're also going to pay an extra $14.50 to Social Security on your monthly bill. First quarterly bill and then monthly bill to Social Security. Okay, so this is separate from your prescription drug plan that you either purchase with the supplemental or that's included in your Advantage plan. So this will be part of your Part B premium that you pay to Social Security every month. Okay. So now we're going to look at our services. So why would you need an insurance agent or a team that specializes in Medicare? Well, there's a lot of reasons. We get you on a schedule, we educate you, we keep you informed, we handle your annual reviews for you, we help you with medication changes, providing a secure way to update your medications each year and make recommendations and changes. We assist you with provider and network support, especially if you have an HMO or dental and vision and you need a separate plan. And then all your annual options. We help you with enrollment support changes and kind of what your options are. Okay. So if you work with us, this is kind of what it looks like. We have a simple 3-step process. First, we have a 20-minute discovery call where we learn about kind of, get your general information, understand the plan that you had in the past, what your medications are, physicians, things like that. And then we go ahead and we put together a presentation for you. And during the presentation, we do a lot like we're doing today. We take you through kind of the basics of Medicare. Then we'll take you through options that are specific to your needs based on the discovery call, and then go ahead and enroll you. And then a few weeks later, we go through what's called an orientation meeting. And there we just go through your current plan, your new Medicare plan after you've gotten your welcome kit. And we make sure you know how to access your benefits. We answer all your questions. And then we take you through some of the things that Medicare does not cover, because there's quite a few things that to be aware of there. And then we also put together a really nice PDF for you, which has all your plan links in there, phone numbers and details. And so it's a really helpful document that we provide for you as well. Okay, so as I mentioned at the beginning, our clients at this point, we usually go through their specific recommendations. These are just kind of general recommendations to give you an idea for option 1 and option 2, kind of what that looks like. Okay, so in option 1, you would be staying with original Medicare. You'd be paying your Part B premium of $202.50. You would be adding a supplemental plan, which would be anywhere from $150 to $250, depending on your age and when you're coming into the system. And then Part D, you could have anywhere from a $0 to a $200 Part D premium. Most of them are $0 to $5, $10, something like that. But if you're, taking a lot of brand medications, it could be more. So if you go with option 1, that's going to give you the freedom to go to any doctor, any hospital throughout the nation without any, real rules or guidelines. And so it gives you total freedom, and your total out-of-pocket spend with your Part B premium would be about $350 to $450. And again, that's basing it on you being at the very lowest tier of $200 and $290 or $290 for Medicare Part B. Okay, so about $350 to $450 all in, and you only have that one out-of-pocket cost of $283 for your Part B, and then co-pays if you're taking medications. Okay, option 2 is the Advantage plan. So again, everyone has to pay Part B premium. So you're going to pay your $200 and $290, and then in California, it's generally a 0 premium for most Advantage plans, and then your drugs are included. So your only real monthly cost here is going to be what you're paying to Social Security, which is the $200 and $290. Okay, so hopefully that gives you a good idea. So thank you so much for attending today. You can please reach out and schedule a call. You can give us a call direct. You can email me, john@RileyEBI.com. If you're an employer, agent, or CPA, we have a website called RileyEBI.com. You can go there, get details, watch some videos, set up a call. If you're a consumer needing help, you can go to our website at Riley EBI or Riley and Associates called MedicareSouthBay.com. Go to MedicareSouthBay.com. We've got videos on there. You can also schedule a call and set up a time to go through a discovery call. And there's no charge for our services, and we're happy to help. So thanks again for attending today and for your patience as we restarted this morning. Okay, thanks a lot.